Good evening, everybody. Welcome to this Facebook Live program. I am Dr. H.V. Shivaram, Chief Surgeon and Senior Consultant in Bariatric and Metabolic Surgery and GI Surgery at Aster CMI Hospital, Bangalore. Today's topic we are discussing about the obesity, weight management, and the option of bariatric surgery in these morbidly obese patients. Welcome to all your questions. I'll try to answer as many as possible in this session. Obesity is a growing problem all over the world. It's a menace which is becoming uncontrollable. To measure the obesity all over the world, we use the body mass index in these patients. The BMI, that is the ratio of the weight and the height in square meters, weight in kgs and height in square meters. This, when the body mass index goes beyond the 22 to 24 and up to 12, 30, we call it as the overweight, then 30 to 32, 35 as the obesity, and beyond that as the morbid obesity. We call it as morbid because as the weight increases and goes beyond the class 3 obesity, along with it many other diseases come. Obesity may be one problem, but it comes with many other diseases like the type 2 diabetes, hypertension, the sleep apnea, the knee joint pain, cardiovascular problems, hypertension, infertility. So this so on and so forth. There are about 20 to 30 diseases which can be attributable to the morbid obesity. So you can understand that you can control one problem, that is the morbid obesity. You can control many other diseases. Especially in India, the childhood obesity is becoming a very big problem. Nowadays, we have in the families 1 or 2 children, and especially in urban areas, they are pampered like anything. There is not enough playgrounds, and also the activity is more of the academic, the physical activity is less, and the parents are also going to work. They don't have sufficient time to look after the children, and the growing population of obese children is definitely dangerous in all the way to our country and to our nation. So there is a question, can a person eat normally after bariatric surgery? There are different kinds of bariatric surgeries, and the bariatric surgery or the weight loss surgery, we do what is known as the restrictive procedure, which is basically to restrict the amount of food you eat. But there are other surgeries like the bariatric surgery called the gastric bypass, the mini gastric bypass. So if you do a restrictive procedure, the amount of eating will be less and you may not be able to eat normally. But if I do a mini gastric bypass or a gastric bypass surgery wherein you can eat normally but still lose weight, because whatever you eat, all the portion will not be going to the blood or to the body, and there will be some amount of malabsorption, or the food which is eaten is not absorbed. So to answer your question, you can get a bariatric surgery, still you can eat normally and still lose weight. But when I say normal eating, you have to eat more of protein diet, a good diet which contains all the balanced diet, minerals, vitamins, calcium, everything, and lot of proteins is required than carbohydrates or fat. So then the surgery will be successful and a person can lead a normal healthy life with a normal weight. There is another question, when should someone consider for bariatric surgery? It's a very good question because we don't do bariatric surgery for each and every person. Most of the people who come to us, they would have gone to many of the commercial weight loss centers, many of the naturopathy clinics. They have tried their best to lose their weight with the diet, exercise, and other possible ways of non-surgical methods. We advise surgery to the patients for who have been totally unsuccessful in losing weight in other ways, and also when their body mass index goes beyond 32.5 with other comorbidities like diabetes, or when their body mass index is more than 35 and there are no other comorbidities also. So in a sense, this is for the health benefits, and bariatric surgery is not a cosmetic surgery. This is done purely to make the person healthy, to improve their mobility, to get rid of their comorbidities like diabetes and hypertension, sleep apnea, knee joint pain, all these things, so that they can lead a healthy, productive life to the nation and they can support their families. There is another question, difference between overweight and obesity. Overweight, we say that when the body mass index or the weight is, body mass index is between 25 and 30. So they are not obese people, they are overweight. Still they can come back to their normal body weight to less than 25 BMI or 23 BMI. But when their body mass index goes beyond 30, then we call them as obesity, because that is the point from where they start getting diseases. Many of you think that obesity is a healthy sign. A chubby child, you might think that he is healthy. But I must tell you that the obesity is not a sign of prosperity. Obesity is a disease. Many of the countries, obesity is considered as a disease, and it is treated with either the natural ways or with surgery, for like you treat for the other diseases like the hypertension or diabetes or anything. Obesity is a disease which needs treatment. What is the age limit for bariatric surgery? That's another question. Usually we don't, in a normal circumstances, don't this surgery on children. We do wait, even though they are obese, we wait them till their bone growth occurs, which may be around 18 years or 20 years. The international recommendation is bariatric surgery to be done only after 16 years. And the upper age limit, it can go up to 70 years or 72 years. That depends not only on the age, but how productive they are to the society. And if you do a surgery and they come back to do normal weight, how productive they are to the family or the society. So upper age limit is around 70, we can say. The lower age limit is 16 years. But in extreme cases, we have done surgeries for children who are 10 years, 12 years, because their weight was very, very high, like 140 kgs, 150 kgs, and they are not able to go to school, or they are not able to cope up with other friends in the family circle or the school circle. So age is a criteria which is little bit relaxable depending on the situation in a particular case. The next question we have, risks of weight loss surgery. Again, a very good question, because there is no surgery without work. Even if you do an appendectomy or a gallbladder operation, the surgical risk is always there, because all of these are done under anesthesia, and also patient has to go under the knife. All the bariatric surgeries which are done nowadays is not a big incision surgery. They are all keyhole surgeries. So when we do keyhole surgery, the amount of pain, the amount of infection or the skin problems and the wound problems are very, very minimal. I would say that the bariatric surgery done under a good bariatric surgery center a multi-specialty hospital under the care of a good bariatric surgery team, which consists of not only the surgeon, the physician, anesthetist, ICU care specialist, and other specialists. There it should not go wrong. The bariatric surgery is quite safe, like any other laparoscopic gallbladder surgery or the hernia surgery. Where the things go wrong is that the people who go into a center which is not very well experienced, where the bariatric surgery is not regularly being done, then things can go wrong, like the staple line leak, which can occur very rarely in about 1% of cases, which can cause into infections and other complications. Another most important problem is with the nutritional problems. The surgery is not the end of the treatment. Surgery, after the surgery also, patients should go to the doctor and keep visiting once in 6 months or once a year, do the blood checkup and see that there is no nutritional deficiency and all their surgery has been successfully being done and monitored by the specialists. So that way, the weight loss surgery has become very successful and also safe. The types of bariatric surgery which is the best? That is another question. Types of bariatric surgery, I told you, one is the restrictive surgery, another one is the restrictive with malabsorption, and other one is the purely malabsorptive procedure. So we have laparoscopic sleeve gastrectomies, laparoscopic bypass, and other many types of bypass procedures. All surgeries are good, but we have to tailor-made or according to the patient's requirements and also the body needs, we have to decide which is the best surgery for them. To tell an example, patients who are having gastroesophageal reflux disease or a hiatus hernia, a laparoscopic sleeve gastrectomy may not be a good choice. They may require a gastric bypass surgery. People who are having a malabsorption problems or some intestinal problems, then a bypass surgery may not be very suitable. So people who are having a liver problems and an early cirrhosis, they may prefer to do a sleeve gastric. So that way, we have to decide or tailor-made the bariatric surgery according to the patient's needs and also the conditions and what we find out by analyzing and examining the patient. Next question is, what is the safest surgery for weight loss? This is a wrong conception that there is something safest surgery and there is something which is not safe surgery. Weight loss surgery or the bariatric surgery are safe, which they are done in a proper hospital under a proper and a good bariatric surgeon who has a good bariatric team where the regularly bariatric surgeries are being done. In such centers, the bariatric surgery is the safest place to get the bariatric surgery or the weight loss surgery done, and not in all the centers and smaller establishments and hospitals. They may have problem of getting this surgery. Is obesity hereditary? Is another important question. Yes. Obesity doesn't come just because you are overeating. So there are other factors like the familial factors, hereditary factors, the environment where we grow and live. All these factors put together, then the obesity problem comes. So obesity is a hereditary disease. Yes, people, the parents who are obese or the obesity runs in the families, then there is a lot of more chance of getting obesity than the people who are not obese in the family. Many times we see that the first one brother or sister comes for bariatric surgery. After a few months, once the patient loses successfully weight, the brother, sister, other patients, people in the family also come for surgery because they find the results of the surgery so good, the benefits are so good, their mobility improves, their other comorbidities disappear. So they bring other members from the family who are obese. There are many patients, many people, the husband and wives who have got operated, and after that they have children also. Pregnant, becoming pregnant or childbearing is not a problem after bariatric surgery. We usually advise them to not to have become pregnant for about 1.5 years after the surgery or 2 years. After that, childbearing is possible. After surgery, how many days will it take to reduce the weight? This is another important question. We should not think that today we do the surgery and tomorrow we will become thin. It's not possible. The weight loss occurs because the amount of the energy required for the activities and the exercise, everything will be spent from the existing fat. So gradually the fat burns and the amount of food or the calories restriction occurs. So to become to a normal body weight, it may take about 6 to 8 months after the laparoscopic bariatric surgery. Every month we may lose about 4 to 5 kgs. Some people initially lose more weight and then gradually it plateaus and the weight loss becomes lesser and lesser. That is the time you have to do more and more exercise and also burn your fat so that the weight loss is maintained, and the restriction of food by basically the eating more of protein food than the carbohydrates and fat, then there will be a healthy weight loss. So it is a gradual process of weight loss and not the sudden weight loss, which is not healthy at all. Other question is, can weight loss surgery offer chances of becoming mother in future? I think I answered this question that getting married or childbearing is possible after the bariatric surgery, and the readjustment in the body occurs for about 1 to 1.5 hours, nutritional readjustments after the bariatric surgery. That's why we suggest that one should not become pregnant for about 1.5 to 2 years after the bariatric surgery. After that, there is no contraindication to become pregnant or childbearing. Definitely, a lot of people who have the PCOD or the polycystic ovarian disease and the infertility, all these people because of the obesity, they get bariatric surgery done, and after that they get married and they definitely have children. There are a lot of success stories in these people who have infertility problem because of obesity, and then they get surgery done and they have children. Weight loss surgery affect overall health. The effect of that's the question. Weight loss surgery effect on the overall health. The weight loss surgery effect on the overall health is good if you follow the rules. I always say that the bariatric surgery is not the end point. This is the beginning of leading to a good health life. So after the bariatric surgery, it is like a trigger. There it starts. You start losing weight. When you start losing weight, a person has to do exercises, should become more and more active, build up his muscles and body, and lose the fat, and then lead a healthy life. So there are 4 pillars for a successful, healthy life after bariatric surgery. The first one is eating a good protein diet. You require a lot of proteins to build up the muscles, to have the strength. That is very, very important. About 60 to 80 grams of proteins one should consume every day. Otherwise, they can have the protein supplements in the form of whey protein, which is good to have a good, healthy, and active life. Second thing is the supplements. These patients may, because of the restrictive absorption and also the eating, there may be vitamin deficiency. So one has to take multivitamins, calcium, and vitamin B12 and D to have a good and active life in these patients. So these nutritional supplements are important. The third thing, most important, is the exercise. You have to do, one is the cardiorespiratory exercises, running, jogging, walking, swimming, whatever it is. Second thing is I have to tone up the muscles to have a good shape of the body. So for that, you have to do some weight bearing exercises. And the fourth important thing is every 6 months or once in a year or so, what we recommend, you have to do the blood test and see that all the nutritional levels are normal, and if there are any deficiencies, we can correct that. If we are keep doing all these four things and we concentrate on these four pillars of the post-bariatric surgery healthy program, then there is nothing looking back, and they will be definitely having a good, healthy life. So overall health of the patients who undergo bariatric surgery and who lose weight will be excellent. Where the people go wrong is that they think that bariatric surgery got it done, that's the end point, there is nothing more to be done, then people will be at risk. They develop nutritional deficiencies, they can become weak, the protein intake may not be good, then they may start blaming the surgery, but it is the fault of the patient not following the advice given by the doctors. Risk of weight loss surgery. So this partially I have already covered. Weight loss surgery in these days, when it is done by a good bariatric surgeon with a good team of specialists in his team and done in a good tertiary care hospital, is very, very safe, and it has to go smooth and the recovery is fast. These surgeries, we don't require any blood transfusions. They are keyhole surgeries. Nowadays, we can do robotic surgery also, the bariatric surgeries, and there are no, apart from the giving the drips for 2 to 3 days, 2 days, there is no other tubes involved, neither any tube in the nose, there is no catheter required, there is no other big bed rest required. They can go get up and walk by evening, or next day onwards they'll be on their own, and after a week or 10 days they can get back to work. So that way, this is quite a safe surgery and a risk-free surgery if done by a good surgeon in a good setup. The cost of bariatric surgery. The cost of bariatric surgery varies from place to place. So if you ask in how much it costs in America, we get a lot of patients who come from international, from the US, Australia, Dubai, and so many other countries, because the care in India is much, much superior. The training and also the equipment and also the surgery is very, very cost effective. It varies from hospitals to hospital, but I can tell you that this is not very, very expensive surgery compared to the amount of gadgets and also the training required to do this surgery. The cost of surgery is minimal. And to tell you about in a 2 sharing room in our hospital, the cost of bariatric surgery may be around approximately 2.5 to 3 lakhs or so, including all the treatment, operation, surgery, medicines, the anesthesia charges, the ward charges, everything. It can vary from hospital to hospital. Is there any way to reduce weight without surgery? Definitely there are methods. The most important methods is what we have to understand is that if we want to reduce the weight, 2 things we have to do. One is restrict the amount of calories we go to our body. Second thing is spend the calories as much as possible. Obesity doesn't come in a single day. It comes over the years. It's a chronic disease. It may start many times from the childhood and gradually creep into the adult, and it continues. So the calories which have been accumulated over the years by overeating, it cannot be gone in a week or 2 weeks or 2 months or 6 months or so. It takes years of efforts to reduce weight, or I can say months of efforts to reduce it by reducing eating and increasing your calorie burning. So this has been successful in many patients who are really determined. And it is not possible to just go for a crash diet for a week and then after that start eating more and more. Is not possible. So the only way to reduce weight without surgery is by reducing the calorie intake and increasing your output of the calorie spending, that is by exercise. Otherwise, there are no great medicines, tablets, injections, all those things may not be very useful in the long term. They can do harm to the body. The other important thing why the weight increases is because of a hormonal effect in the intestine. There is a hormone called ghrelin hormone, which is present in the fundus of the stomach. We call it as the upper bottom of the stomach. When the hormone effect is more, then it causes increased hunger. It deposits the fat in the body. It causes insulin resistance. It doesn't allow the burning of the fat and calorie expenditure. All these effects can be reduced by reducing the ghrelin hormone in the stomach. Unfortunately, till now there is no tablets, injections, or any other method of reducing the ghrelin in the body except the bariatric surgery. So the bariatric surgery has got the hormonal effect to reduce the ghrelin hormone in the body. Thus, it reduces the hunger, the appetite, and also it causes reduced insulin resistance and the body fat burning increases. So these are the ways of reducing the weight by calorie restriction and also the increased calorie burning. So ladies and gentlemen, we discussed what is obesity, what are the methods available for the weight management issues, and also what are the types of bariatric surgery, and also what are the risks of bariatric surgery, what are the benefits, how we can lead a healthy and normal life after this bariatric surgery. So all these things are possible nowadays with the modern advent of laparoscopic surgery or a keyhole surgery, which has made the bariatric surgery is a very safe and effective procedure for people who are suffering because of overweight. There are people who are 150, 200, 300 kgs who are totally dependent on others, are not able to carry on their normal weights, normal activities. So such people, this is a great boon to have this surgery done and also to have a normal, healthy, happy life. Thank you all for this interaction. I hope this was useful. See you again. Bye-bye.